sociology.
Thanks very much, and thanks very much for this initiative, and for inviting the voice of health. So I'm an emergency doctor in Yellowknife in Canada's subarctic. I serve a majority Aboriginal population, some of Natan's people, the Erasmus's people over there, who are already coping with temperatures 2 to 3 degrees Celsius above baseline. We are melting. When I went up there as a new emergency doctor, I had never been taught about climate change. And then I read the Lancet, the world's most prestigious medical journal's 2009 report, which said that climate change is the biggest global health threat of the 21st century. I had been taught to treat heart attacks and strokes, and I wasn't sure how an emergency doctor was supposed to treat climate change. And then in 2015, the Lancet's second report told us that tackling climate change could be the biggest global health opportunity of the 21st century. And they set out a list of things that, if we tackled them, would give us win-wins for health now and for the planet. One of the biggest ones that they mentioned then, and they continue to mention, is coal phase out. So the 2017 Lancet Countdown Report, which caused headlines internationally over the last couple of weeks, recommends coal phase out as one of its main measures. It was also one of the main recommendations of the UK brief that was associated with it, and of the brief that was done in Canada, co-authored by me for the Canadian Public Health Association. So this has broad support within the health community worldwide. Phasing out coal is about decreasing greenhouse gas emissions, seeing less trauma, less displacement, less deaths from heat exhaustion. It's about seeing less burns from wildfires, less clouds of smoke causing breathing problems. It's about less malnourished children. It's about less conflict, less migration. It's also about seeing less kids with asthma puffers right now. Less emergency visits, less costly hospital admissions. As Chris Ballard said, we've really seen a difference in Canada from having done this. It's about decreasing the long-term health impacts of air pollution, which include cancer, cardiovascular disease, stroke, lower respiratory disease like chronic obstructive pulmonary disease, and deaths. Over 800,000 people a year just in a few countries die from coal power, and that number, having recently spoken with Nick Watts of the Lancet Countdown about it, will actually get bigger as we take more countries into account. It's about, as Nathan said, less neurodevelopmental problems in young people from mercury poisoning. It's also, as we begin to understand planetary health better in the feedback loops between people and the planet, about less water pollution and less habitat loss because of coal extraction. So health professionals worldwide are beginning to treat climate change by coal phase out. The Canadian Association of Physicians for the Environment, of which I'm the President-Elect, the Canadian Medical Association, the Canadian Public Health Association, all were part of the coal phase-out that Chris was talking about, as well as the phase-out commitments in Alberta and Ontario. And just this last week at the Global Climate and Health Alliance Summit, held in association with the World Health Organization, we spoke with health professionals and medical students from across the world, some of whom are here, to teach them how to treat climate with coal phase out, what advocacy techniques work, who do you need to partner with. Now, climate is not something that the health profession was early to, but we learn fast, we don't need a lot of sleep, and we are used to dealing with crisis. So, as an emerge doc, I know what it's like to act too slowly and to have a patient die. The first time a child ever died under my care was on a malnutrition project in the Horn of Africa, and it was one of the worst moments of my life. I wanted to disappear through the crust of the earth. That said, I also know what it's like to act quickly enough to do the right thing and to pull someone from the spiral back into a place where they can thrive. And I'm acting on the assumption that planets are the same as people. So in partnership with my partners in the health community and with all of you, I really look forward to how we can treat the climate with coal phase out and move forward to a healthier planet. Thank you.